Dr. Felice Chan is a board-certified traditional Chinese medicine practitioner and acupuncturist here in Los Angeles. She bridges ancient Eastern healing with modern science, treating the body as an interconnected whole rather than isolated symptoms. In this conversation, we explore the foundational principles of traditional Chinese medicine and how understanding them can shift the entire way how we view healing in the body. Hi, Dr. Felice Chan. Thank you so much for being here today, especially in person. As we were just talking, I love how we can have a conversation in person because it does give it a little bit something extra versus virtual.
Absolutely. I'm there with you.
Yeah.
Thank you for having me.
Of course. Well, there's a lot to dive into, especially when it comes to traditional Chinese medicine. But before getting into all of the nuances of it and the explanation and how it can really benefit our own healing, I wanted to kind of take a little bit of a step back to your overall experience, because I know you didn't necessarily always start in traditional Chinese medicine. You do have a background in more Western care, in neuroscience specifically. And I think it's really important to talk about some of that expertise because, at least from my perspective, when I look at social media, there's so many experts and healers and coaches and all these people that are out there, and it's kind of hard to discern who has like the background and the experience. And that's why I'd love to talk to you a little bit about how you got started.
Yeah, so it started all the way back when I grew up in Hong Kong. So I was born and raised in Hong Kong. And it's ironic where in the household, it was very much Chinese medicine, right? How we ate, how we drank soups, the lifestyle. But I studied Western medicine ever since I was a young girl. I knew I wanted to be a doctor since I was probably 5 or 6, whether it was like a, sole purpose situation. I just wanted to be a doctor, a girl in a white coat. And I went to an American international school and then came to the US for college. And that's where I studied pre-med and neuroscience. And I think a big factor of that is that my aunt is a neuroradiologist. And so I spent a lot of summers shadowing her and her team. And I loved it, right? It was very much summer spent in the OR, watching surgeries, watching brain surgeries, back surgeries, understanding it. And it was enlightening. And so that's the path that I took, hence why neuroscience in college. And after college, I actually spent a couple years doing clinical research at a hospital in Boston. And it was then where I realized that I wanted to take a shift back more into traditional Chinese medicine, a true like 180 turn, because of how I felt my values meshed with the medicine. More understanding the mind, body, and soul together and spirituality. And that's what drew me back to Chinese medicine.
When you say values, can you dive into that a little bit more?
Yeah, absolutely. I think personally, I went through my own health journey, but also I was craving answers and solutions that really got to the root cause. I think Western medicine and Eastern or more traditional medicine is definitely important to be integrated. However, they all have their place. And I was looking for more root causes and understanding, how to actually heal someone and not just put a Band-Aid on it with pharmaceuticals, because that's a huge part of Western medicine.
Would you say then, because when you say root cause, I know that is very core to like functional medicine. Is traditional Chinese medicine sort of in that same vein then?
Yeah, where let's say once we figure out the root cause, and in Chinese medicine, we say pattern diagnosis by the way that the organs work or the meridian systems work, then a lot of the cascading symptoms start to dissipate. And a lot of the times they're tied to certain ways that we see the body. And once we can target that and work on it, someone will start to feel better rather than like, let's just address headaches or insomnia, but rather like, what is that root cause causing all of those symptoms?
Yeah. So it's not just like the symptom or like taking the whatever Tylenol or whatever it might be for that one specific symptom. It's actually like looking at the whole body.
Correct. Yeah.
So what does that look like as far as I know there are certain pillars of traditional Chinese medicine. Could you kind of dive into that?
Yeah, absolutely. I always love to share that Chinese medicine, there's 4 main pillars. The first one is acupuncture, right? Or acupressure based on the meridian system. We have these meridian systems that connect our toes to our head, to our hands, right? And they are there. They are present. It's very much embedded within our fascia. And we have something called qi or energy that runs through the meridians. And it's very much present. I think it's interesting where Western science is finally catching up to the existence of meridian systems, where now electromagnetic, readers can read it. And now there's some studies that actually show some dye that run through the similar meridian systems. And so that's what acupuncture is. And that's how I think most people find Chinese medicine here in the Western world, because they hear that, acupuncture helps someone's back pain or headaches. And they're like, let me dive into it. But it's very much rooted in this holistic system of the body.
Wait, can you talk a little bit more about that study? That sounds really interesting with the dye.
Yeah, it was about the pericardium channel, which like runs through our hands, and it's very synergistic to the median nerve over here. And so we're just like, okay, this really shows that there is this pathway that exists. Um, yeah, it's wonderful, and just the way that the energy works, we can feel it. And I think it's more so Chinese medicine is a medicine that it's energetic and spiritual, and it's out of the five senses of our perception, right? So how do you actually tune into what is not in this physical world, but also what is in the energetic field? It's tied to quantum physics and mechanics, and it's present in our body. But a lot of people have to train their bodies to understand that it does exist in us.
There's a couple of things that you had said, just sort of the emotional side of things and how that's also connected.
Yep.
And then you also mentioned fascia. And I feel like I've been seeing some content lately about how fascia is related to emotions and sort of that work. Could you talk a little bit about that?
Yeah, absolutely. In Chinese medicine, I love to talk about emotions because one of the first texts that I ever read when I first studied Chinese medicine was that every ailment in the body starts from emotions, right? We're human beings. We feel these emotions, and it's incredible to feel the emotions, but we feel the heavy ones and the light ones. And it always changes how our body reacts, right? Physically. If we're excited, our heart rate increases. If we're anxious or stressed, our body starts to hold in energy in our chest, right? We can't breathe in deep. We get the stomach pains. So every reflection of emotion is present in the body. And so a lot of the times that can go even deeper, right? With trauma and how trauma is held in the fascia or essentially in our muscles, right? Our body holds the score, right? And it doesn't let it go unless you allow it to, or you teach your body that it's okay to feel it and to let it and to pass it, right? Because I think, in Chinese medicine, we love to understand, feel the emotions, but let it pass. Because as soon as you can't let it pass, it starts to get stored somewhere else, right? Whether it's in the meridian system, the fascia, the organs itself.
And that's something that when you work with patients, do you go into that emotional work? Or even if you don't talk about it with your patient, you're able to see it as you...
Yeah. Both.
Okay.
It really depends. Sometimes patients come in and I will verbatim say, like, how are your emotions, And sometimes they are taken aback, but sometimes, depends who it is, they'll completely open up. And I find that a lot of people coming in with some type of emotional trauma, it's one way or the other, right? Where they're really protective of their energy, or it's the first time where they feel safe to then express it. But even if they don't express it, you can tell where it is. And even after the treatment, they'll cry, they'll feel more open because things are moving the first time, or they'll come in the second or third time and finally open up. And I think it's not, opening up to me, but more so them understanding themselves that it's important to address it. And I think that's a huge part of healing.
What has been so interesting for me when I've gone into acupuncture a couple of times is that, I go in a very heightened state, like I can feel my body very tight. And then of course, like through the session and then afterwards, I do feel relaxed, but then I do get a bit emotional because I'm in such a relaxed state.
Yeah. I love that. I mean, it's also the switch from that sympathetic to the parasympathetic rest and digest, right? Where we're actually able to heal and fully relax and dive into our emotions. And that's what Chinese medicine is amazing at doing.
What are some common things that you're seeing in your patients lately?
I mean, stress and anxiety, always present for every single person that comes in, right? But it's also how their body manifests it, right? Is it shallow breathing? Is it gut issues? Is it insomnia? And so I think the root of a lot of things happening right now is stress and kind of the go, or kind of the dysautonomia where our nervous systems can't switch back and forth.
So with stress, obviously everyone has it. So you did talk about how it can manifest in certain ways. What has been most common that you've been seeing?
Gut issues.
Gut.
Especially here in the Western world. I mean, there's so much that goes into play with the food quality and how we eat, but also how stress really impacts gut health.
Yeah. When you go back to traditional Chinese medicine and even maybe the foods that you grew up with in Hong Kong, what does that look like then as far as that more traditional approach versus how we're eating here in America?
Yeah, I love this question because I moved to the US for college, and that was the first time I was very much thrown into Western food, right?
Yeah.
And it's not like I didn't have food here growing up in Hong Kong. You know, Hong Kong's very international, but it's more so the staples of every day. You know, growing up, having a breakfast or 3 meals a day was always very much ingrained. And coming here, I realized that it's not so common. I had to actually change my mindset of, people are busy in the morning. They want to skip breakfast, or they hear about intermittent fasting and they think it's good for them. And it's necessary for some people, but for the most part, it's probably not good for you, right? And you have to really understand whether it's right for your body. And I think that's one of the biggest shifts of eating patterns that I have to reteach my patients, but also that I was shocked when I moved here, but also the type of food, right? It's the whole foods that we grew up. We would grow up where every dinner my parents would cook a broth, like, some type of Chinese soup. It was always a meat high in collagen, Chinese herbs, and something sweet but naturally sweet, like fruit. We'd put papaya or pears or apples in soup, and we'd boil it for hours and drink it. So that was really gut nourishing, ready. It was warm. And so coming here to understand how people eat, how a lot of the foods are processed already, and just really breaking it back down to the whole foods itself. Let's focus on that.
It sounds like with Asian food, it is very, it's more savory, it's more warm and soothing,
warm.
versus here,
we go.
we're always eating salads and cold pressed juices and smoothies. Like, is that not actually good for us, or what's your perspective?
From a Chinese medicine perspective, that's probably the worst thing for your gut health and for your energy. And I think there's, a new understanding of why. I think there's a shift in kind of the food culture and the health and wellness culture where they're like, we have to eat our greens, we have to get this amount of, vitamins from vegetables. But in a sense, there was almost a lapse of understanding what our body can absorb. We're warm-blooded, right? We have this metabolism, or in Chinese medicine, we say digestive fire. So you have to nourish it with warm foods. If you put something cold in your body, let's say smoothies, green juices, salads, you're kind of putting a shock to your system. Your digestive enzymes, first of all, have to be warm to work at its optimal, like 38 Celsius or like 97, 98 Fahrenheit. So when you put something cold, it's working on overdrive to warm it up first before it can actually absorb the nutrients. And so when it's working on warming up before it can absorb, you're kind of putting on an overdrive, and it gets tired, and then it gets lazy, right? And then it leads to things like gut issues, bloating, loose stools, which is then tied to brain fog or feeling lethargic. It's really stemming from our digestion.
That is so interesting. And I love that you're sharing this, because I feel like that's all we're hearing is like, eat the salads and eat, but that's actually from the traditional Chinese medicine perspective, not actually as healing as we think.
Yeah. And I mean, firsthand, I see it a lot in my clinic, right? When people come in and they're like, oh, that's what I usually eat. I'm like, truly 1 to 2 weeks, warm cooked foods, no smoothies, no ice cold water, like iced coffee, iced matcha. That's also part of it too, right?
Yeah.
And even that shift, it gives them more energy. Their hormones start to level out. Their sleep gets better. Their bloating dissipates. It all stems from our digestive chi, or energy, as we say.
I definitely have to make some modifications to how I'm eating too.
Yeah, but I mean, at the same time, it's about balance, right? Here
Yeah.
and there, I'll have a salad on a hot day. I don't have iced drinks, but that's also my preference, right?
Yeah.
And it's really understanding how you can train your body to then, bounce back or have a rebound rate, where then you don't get bloated if you have a salad. But I think most people's baselines here in the Western world, because of how they're trained to eat, is a little bit lowered already in terms of where they're at. So how can we retrain it? Perhaps you have to omit the cold foods or the ice cold drinks for a little bit so your body can recalibrate. But I want you to live a life and have fun and have the ice cream here and there,
Right. Okay. In an ideal day of your own diet, or what you would recommend to a patient, what would that look like as far as meals and snacks and everything, just to give people an understanding of something tangible, how they can really put this into practice?
Yeah, definitely a breakfast. I always focus on a warm, protein-rich breakfast, ideally by 9 o'clock. And the reasoning for that is that every organ in Chinese medicine has a 2-hour window where its chi, or energy, is strongest. And when it's strongest, you actually have to fuel it during that time, right? And so the stomach wakes up between 7 and 9 in the morning.
Okay.
And so when you feed it at that time, you're actually strengthening its energy to actually absorb the food, then to move it to the spleen in Chinese medicine, which is the next 2-hour window from 9 to 11, to transform and transport it to the rest of the body, which is giving you the energy you need. So eating in the morning is one of the most important things. I love my warm oats. I do a savory oatmeal a lot, where I'll, get organic quick oats sometimes, or if I have time, I do steel cut oats. I crack an egg in there, put some black sesame seeds, a dash of sesame oil, scallions. It's so good.
That
It's
sounds
so warm.
delicious.
It's delicious. And then I love to like put on, kind of like chopped avocado on top. That's more room temp. Some cilantro, anything you want. It is amazing. That's how I start my breakfast. And then to have a lunch, right? A lunch, let's say between 12 and 1 is ideal because that's kind of the next shift in how your body needs it. And then to have dinner before 7 o'clock. And so in Chinese medicine, we love to have the 3 meals a day, the consistency, and not so much the snacking, because the snacking means that your spleen again and your stomach is working on overdrive to keep processing it, but it needs to rest. It needs to work and then rest, work and rest. And if you're continually snacking through the day, you're making it work, right? So how can you actually train it so that it works to its optimal level?
That's actually a really interesting point as well, because I do feel like a lot of the narrative that we hear is like, oh, like eat smaller meals, but snack. So you're like constantly kind of eating throughout the day, but you're saying like maybe that's actually not optimal from the TCM perspective.
Correct.
Yeah.
And I understand because I came from Western and Eastern. I've heard it
Right.
all, right? And people are just like, oh, but snack through the day so you train your metabolism to work faster. But what I've seen, to be honest, is it's that breakfast time. It's that consistent meal. And most people, especially when they have more systemic issues, they're not having a protein-rich breakfast.
Can you speak to a little bit more about the protein side of things and also just that nutrition macronutrient profile of what we need?
Yeah, absolutely. I think a good example is, let's say someone starts with a smoothie in the morning, whether it's cold or room temp. Some people are like, can I have room temp? I'm like, just eat the fruit,
Yeah.
Like, why are you grounding it
Right.
up? It's sweet, right? If you're putting fruit in, it's literally sweet in your body. You're spiking your glucose levels, your sugars are going up. And when that happens, your energy is going to dip, right? Your glucose goes up in the morning, it's going to dip. And that is very much tied to hormonal health in Western medicine, right? For women as well. So you need the protein to hold down any of the sugar spikes later on, but you also need the protein to give you energy. You need protein to fuel you. It's what makes you actually feel full, so that you have enough to eat during the day. And a lot of the times when people have like sugar cravings at night or they want a snack at night, it's because they're not eating enough protein during the day, especially in the morning.
Interesting. Yeah, actually the other night I was like, I never really want sweets, but towards the end of the evening, I had wanted like a little sweet treat. And I did actually think about like, oh, well, what did I eat? Well, I actually only ate like one meal and I had skipped breakfast. And so like my diet for that day was all off. So it really does show up in terms of like what you're craving.
Yeah, absolutely. And I mean, I've been in that smoothie kick. I remember when I was at the hospital, I was in Boston. I was walking to work in a snowstorm holding a smoothie. And, my body was in a different state then, but I was very much in tune with, why am I sneezing all the time? Why am I cold? Why is my digestion off? Why do I feel puffy and bloated? And not until I kind of had that wake up call to be like, okay, let me go back to my roots in Chinese medicine. Did I really shift? And then that's when I propelled into studying it. Yeah, so I've been there.
Yeah.
I get it.
Yeah. Okay, so you have talked a little bit about the stomach, about the spleen. So I kind of am curious about the other organs and the role that it plays within the body.
Yeah.
And I'm selfishly going to ask about the kidney because I actually had kidney cancer. And so I removed one of my kidneys. And I know in TCM, the kidney is extremely important. So if you could even just start there.
Of course. The kidney in Chinese medicine is very important for our Jing, which is translated to our essence, right? It's kind of, we always say there's a prenatal and postnatal essence. What is given to us from our parents, essentially genetics, right? What gives us our hair color, but also kind of the vitality, and why people say, your grandmother is 95 or 100, you have good genetics. That's kind of the prenatal Jing. And you can't really change that because it's genetic, but then there's the postnatal aspect of it. So how can you nourish your kidneys, right? It's how do you pay attention to your body? How do you not overtax it? Because when we think about, the biggest example I like to say is like, if you're overworking, like physically working, your low back starts to hurt. It's where your kidneys are, you're overtaxing it. So how can you nourish that? But it's also very much tied to what we say women's health. And almost when we reach like that perimenopause, menopause state, our kidneys start to get weaker. It's where we start to get what we say, the hot flash symptoms or the menopausal symptoms, because the kidneys in general are also so important for fluid metabolism, right? Also in Western medicine, where you have to filter through the kidneys, then to urinate and to pee, but it's also really tied to the nourishment and all that yin, or that fluid that is tied to our essence as well. So how can we keep that vital in our body? It's eating the foods that nourish our kidneys. It's making sure that we're not constantly sweating and thirsty. So how can we support that?
What about the heart?
It very much plays with Western medicine, right? The heart pumps blood to the rest of the body. And so we call it kind of the emperor organ. in terms of circulation, but it's also one of the organs that is so important for our spirit. So we have a spirit called Shen in Chinese, and it's something that we can't ignore. I love the heart because it very much ties into the spirituality of Chinese medicine. And it's very much intertwined with our body, how we feel. And so whenever anyone has heart palpitations or heart issues, I always ask about, okay, how is your emotional health, right? Because everything is stored here. For example, a good example is, let's say someone has insomnia at nighttime and they're restless. Their Shen or their spirit isn't actually resting at night. So what is causing that to not rest, right? Is it the imbalances of too much caffeine, for example, that's increasing the heat? Is it other triggers of anxiety? But that's all the heart.
Can you speak a bit about, I know that we've talked about how everything is connected. I'm very interested in reflexology and also the ear.
Ears, yep.
Yeah. So maybe if you could dive in a little bit
Of
there.
course. So in Chinese medicine, we can start with the ear. The ear, we say, is a microsystem of the body, meaning every part of the body is reflected on the ear. It's why ear seeds are trending, why ears are so powerful. From a Western standpoint, the vagus nerve runs through it, right? And so the vagus nerve is really important to help our nervous system switch from that sympathetic to the parasympathetic. And in Chinese medicine, there's almost like an upside down fetus or body. The, faces by the earlobe, it kind of wraps around our back, and then our feet and kind of like our woman's health up at the top, right?
Oh,
so
interesting. I never thought of it.
whenever,
in that way.
yeah, it's amazing. And so you actually have a physical body represented on it. So you can help anything from hypertension to back pain to menstrual issues to hormonal issues, histamine, allergies, all from the ear. And so that's why it's so powerful. So sometimes I'm like, if someone's just like, what's one tip? I'm like, touch your ears, massage your ears. It's amazing for the body. Similar to the feet, right? We have so many important channels and points that start at the feet. Our liver channel, our kidney, our spleen all start in the feet. And all those channels go up the leg into our uterus, especially for women, also men as well, in their reproductive area, and then up into our body, right? And our liver channel, which flows through our liver itself, goes into our eyes, So for example, if someone has red eyes or itchy eyes, it's all relevant to the liver channel itself.
I'm just so fascinated by this. And I feel like whenever I'm in a heightened state, like I'm going to want to do this to to myself to just like get into that parasympathetic state.
Yeah, it's so relaxing.
Yeah. So you've talked a bit about like the fetus, women's health, hormones, and I feel like that's such a huge topic, especially for women in their 30s and 40s as well, of going on fertility journeys, which I am on one myself, but then also inching closer to like perimenopause. So there's just a lot that I think women need to understand about their bodies. And I think also probably a lot of women are potentially going through maybe hormonal imbalances that maybe they don't know about. So could you kind of talk a little bit about that?
Yeah, I love that question. I mean, hormones, it's such a big topic, but how the Chinese medicine system really recognizes it. I would say, there's two different sections of it, right? Let's say if you're 30 versus 40 and what stage you're in. I think, as a practitioner, what I look out for is, let's say you're 30 and you're going through your fertility journey, are you having a regular menstruation? What are the symptoms you're feeling? Because everything that your body is telling you is a cue to what is off balance, right? Are you having the PMS symptoms? Are you feeling irritable? Do you have breast tenderness? Are you getting cramps before? Are you getting, loose stools before or during the period itself? Like this might be TMI, but like what color are your clots? What color is the blood? How long is it? Do you have headaches during it? Like every symptom that you feel before and during and also after a period is so indicative of what the root cause or imbalance is, which is then tied to hormones in Western medicine. It's fascinating because like when someone comes in, they're just like, oh, my testosterone is high or my estrogen or progesterone's a little bit off. I'm like, okay, amazing. But at the same time, it doesn't change the way that Chinese medicine sees it, right? Because it's based on your root cause. And eventually, through consistent acupuncture, consistent herbal medicine, which is also another pillar of Chinese medicine, it starts to level out. And then they go get their blood test done and everything is, essentially back to normal.
Let's actually talk a little bit about the herbal supplementation and how that can, I guess, supplement or complement acupuncture?
And so I think beginning, we talked about acupuncture being the first pillar. The second pillar is herbal medicine, right? And it's very much integrated into acupuncture study. I went to school for 4 to 5 years, and it was very much a sector in Californian like acupuncture accreditation and board that we had to study herbs. And I love it because it's something I grew up with, but there's so much about herbs that I didn't know before I studied. For example, every herb has a direction it goes, right? It goes up, it goes out, it goes down. And it's very important to understand that because there's a directionality to it, or like an organ space where it kind of occupies. For example, goji berries. Goji berries are amazing. They're kind of thrown into acai bowls now, but in Chinese culture, they're cooked warm in tea or in soups. And the directionality, it actually nourishes the kidneys and liver. It nourishes blood, but also goes into the eyes. And so every herb has a direction to organ and also in the body. So if we're able to combine certain herbs together, how can we actually create the best effect for the body? Another portion of herbs is, yes, we talk about single herbs, but in clinic, I'll never just give one herb. Formulation is always a combination of, between 5 and let's say 15 herbs, because each herb has a nice kind of play with each other, right? They synergistically boost each other. So how can we really take advantage of that?
Is there ever a time where taking herbs is actually harmful in some way for people?
100%.
Okay.
A good example is if someone's taking a ginseng supplement every single day because they're like, it's an adaptogenic, it's great for energy.
Right.
But in nature, ginseng is hot. So if you're taking it every day and you have symptoms that are hot, maybe the hot flashes, you're sweating, you have anxiety, you have insomnia, those are all symptoms of heat, it's going to make it worse. And so with herbal medicine, it needs to be very much tied to your presentation. It's why I believe like creating Chinese medicine supplements are a little bit difficult because everyone is individual. And that's what I love about Chinese medicine. It looks at the individual. It never treats person A and person B the same with, let's say headaches or perimenopause. It's always going to be different.
In your practice, do you actually work with Western doctors through your patients, or do you have that kind of connection point just to see like if someone's on a certain medication or whatnot, and just kind of have that collaborative kind of relationship?
Yes, sometimes. It really depends on the patient, how open they are, also the doctor itself, whether they want to collaborate or to be integrative. In my clinic itself, we're just Chinese medicine doctors, but we always, like whenever a new patient goes in, I want every supplement and medication, right? Because also with Chinese herbs also have some interaction with Western medicine.
Okay.
And so we have to be careful with that, but also understanding the energetics and of supplementation and medicines too.
I think this is so important because, I have a lot of Western doctors that I see, and they're never as receptive for me to incorporate traditional Chinese medicine. But whenever I do see someone that is traditional, they're a lot more receptive of working with the Western
It's just
world.
education. I mean, I understand it. I mean, before I dove into Chinese medicine, I had no clue. I mean, there's 400 plus herbs in what we see in the Materia Medica, which is this massive textbook of herbs. We went through 4 years of education to learn it. I'm still learning every day. I still refer to it. And so how can a Western doctor who never studied it understand it? And so I think it's finding trust and understanding and opening your mindset to be like, okay, there's other ways to support you. Let's just work with a doctor rather than completely shy away from it,
Yeah.
Because it's easier to shy away. It's easier to ignore it and just say, no, I don't trust it, because they don't know it.
What do you see, or what's your vision or wish for the future of how people approach healthcare?
Oh my gosh, I love this question because in an ideal world, if politics weren't involved, I would love a Chinese medicine doctor or hospital here in the US. I would also love Chinese medicine to be fully integrated into the insurance system. I think that's one of the biggest barrier to acupuncturists like myself, but also to patients. I don't take insurance in clinic. And one big reason is that I have to be able to support a clinic then to see more patients. But let's say I apply for insurance, they'll pay me $20 an hour. I can't sustain a practice that way, but my education is the same as other Western doctors and they get paid, $2,000 for a 15-minute consult. So how do we make it make sense in the medical field? Ideally, if acupuncture was part of your insurance and they come see me and then insurance pays people out, the world would be a happier, healthy place because it is a preventative medicine in itself. It kind of helps people rebalance before any of the Western diagnoses happen, right? Before autoimmune conditions happen, before, let's say, hypothyroidism or menopausal symptoms where they need estrogen patches, for example, right? But then that's the whole backward system of the medical system here, where then they give pharmaceuticals for those issues, right? But Chinese medicine is all about the in-between. How do we bring them back into balance before that happens, right?
Yeah, I know. Like as a patient myself, I would love to see the integration of traditional Chinese medicine, something that looks at your body more holistically.
Yeah.
Because I'm at a place in my health journey where I'm seeing, 10 different specialists for different things, and each one wants to give me a prescription medication, except one medication is to offset some of the side effects of another one. So then you're just kind of stacking medication, and it's quite frustrating.
Yeah. I mean, in a sense, I think medication is very necessary for acute conditions, for emergency conditions, right?
Yeah.
But there is always another alternative. And I think people have to open up their minds to it. I think it's going to be a cultural shift as well. And I think kind of a shift to not wanting that quick fix, but really understanding and being intuitive with your body.
Speaking of being intuitive with your body, what are some things, because we did kind of talk about, when women are menstruating or like looking at, blood clots and like the consistency and all these things. I think there are things that we're just not being intentional with or making ourselves aware of. So what are some ways that women or people in general can start to lean into their intuition and pay more attention to what's happening in their body?
I think the biggest way is to pay attention to how food makes you feel.
Okay.
Not just the type of food, but the temperature. Like, for example, drink an iced matcha one day and then drink a hot matcha the other. How does your belly feel? Are you bloated? How's your energy? Like after an ice cold matcha with, let's say, milk, it's very damp and cold. Someone's going to feel sticky in their tongue, People are going to feel kind of stagnant energy here. I think it's really tuning into how your body responds to food, but also emotions, right? Food and emotions. If someone pisses you off, if you're in an argument, how does the energy feel in your body? Is it stuck over here in the throat area? Is it in your belly, in your diaphragm? Because once you're able to target that, then you can really recognize, okay, this is here, but how can I move through it, right? You can breathe through any stagnation or stress that's in the belly too, right? You can take a step back from eating foods that trigger you. It's how can you tune into your body to see how it responds.
Yeah. And I think actually, to the credit of some registered dietitians I know and nutritionists, like they always go back to food as well. If you're feeling, if you have an ailment or some kind of diagnosis, to start with the food, because that has such a huge impact.
Oh, of course. I mean, and that brings us to the next pillar of Chinese medicine, which is food as medicine. There's 4 total, there's the acupuncture, acupressure, the herbal medicine, but also food as medicine. And how can we integrate that in our 3 meals a day? How do we nourish your body to seasons? How can we eat seasonally? Like, let's say I have a belly ache or I'm bloating. How can I cook a meal that nourishes it? For example, congee is amazing, right? Or porridge, sweet potatoes, oats, something warm and nourishing like a soup is also amazing to heal the gut because it's gentle. So how can we tune into that?
So you mentioned a few things of like congee and all, like I love all of that. But let's say you're someone, and I am someone who struggles with like insulin resistance and like a higher blood sugar, higher A1C. So how do you kind of navigate certain diagnoses with some of the maybe warming things that traditionally would be good, but perhaps, making it work for certain people?
Yeah. I mean, for example, congee, yes, it is rice, right? So it can spike glucose. Instead of that, have bone broth, right? Bone broth and vegetables, because it's still warm. It's still amazing for your body. It's still boosting the blood and energy. And there's always alternatives to it.
Yeah. I like this because it's, you have said this in the past of like, it's not one size fits all.
Yeah.
It's really working with your body. And there are ways to do that.
Yeah, absolutely.
Okay. So I have a little thing. We're going to do a little intermission right now. So this is something that I'm kind of like prototyping with my guests, especially in person.
Oh, I love this.
There's different questions on here. I don't know what you're going to pick. So some of them are like, intense, and some of them are like, what's your favorite drink? So we'll see what you get.
Okay.
You can pick a couple, but here's
This guy?
Okay.
Oh, we got 2.
Okay.
Okay, I'm going to read the first one.
Okay.
Ooh, what's the most honest conversation you've had with yourself recently? Ooh, this is a good one. Honestly, probably last night during the full moon.
Okay.
I mean, it's also
Yeah.
Mid-Autumn Festival and the harvest moon. And in kind of Western astrology, it was a very powerful moon. It's a supermoon because of its closeness to the earth. And in Chinese medicine, we are nature beings, so we respond to the sun and the moon and how it is present. And last night, whenever it's a full moon, I always feel more triggered emotionally, but also feel more power to then manifest or to kind of tap into kind of my soul purpose. And so there's a lot of charge, let's say.
Yeah.
So I had this conversation with myself last night. I was like, I could literally pick a fight with my husband, or I could be patient, breathe through it, but also kind of tune into why my body's feeling that way. So I was journaling a little bit last night and this morning about, what I want the next phase of the rest of the year to look like. How I'd love my manifestations to come true, but also how to really tie back to like my spiritual practice. That's an honest conversation I had.
I really like that. And maybe we can talk a little bit about that just as far as like TCM and how we're so connected with the seasonality of like what's happening in astrology and the world.
Yeah. Absolutely. I mean, Chinese medicine, it's not just a medicine, but it's a culture. I think it's easier to frame it that way, where there's a festival called Mid-Autumn Festival or Moon Festival in Chinese culture. And, there's obviously allegories and stories of, it's a love story in a sense, but it's also to thank the earth or Mother Earth for harvesting enough food and giving us abundance, right? So it's really reconnecting and being grateful for what is given to us in nature. And so even with these rituals and even with the medicine, it always ties back to where do we come from? Like, how do we respect what is nourishing us?
And I love that you kind of leaned into manifestation and gave yourself a little bit of that silence and space. I actually did, oddly enough, feel very emotional yesterday. And I was just it felt very stressful. I was just like very charged, and I actually didn't know at all that it was a full moon. So now maybe there's a little bit of an explanation.
Yeah. Yes. I mean, absolutely. I mean, when we think about how much water is in our body, how the moon literally moves tides, right? It's moving tides in us. It's moving this chi in us, this blood. It's all the fluid. Hence why we're more charged.
Do you have a specific ritual that you do maybe like every month when the full moon comes, or?
To me, water grounds me. I always love, hence the moon moving waters. It's very similar to what's happening in our body. I'm in Aries, and so what I find calming is water, right? It's the Pisces in me. So last night I literally hopped in a sauna and then jumped in my pool. It was really cold, but it was so releasing for me. I think everything that I was holding on to just kind of washed right off, or taking a hot shower or a bath. I always kind of prioritize that.
Okay, yeah, I love that. Just because I like to leave people with something tangible that people can really lean into. Specifically, if it's full moon, maybe that can be like a monthly ritual that people dive into themselves.
Any type of water. And, when we think about the moon in Chinese medicine, it's very yin, it's very dormant, it's quiet. And so that's essentially what water is. Like moon and yin and water all come in the same bucket, whereas sun, the yang, the yin to the yang, and heat is all, in the same bucket. So how can we kind of shift into that slower dormancy? And so water is a great pair.
This is a little bit tangential, but kind of related. Just thinking about the natural cycles of the world, and then also thinking about the natural cycles for a woman as well throughout our menstrual. Yeah.
Yes.
So there's a little bit, if you could just dive into that a little bit. And I know that previously you had mentioned eating seasonally. And so I feel like everything is kind of connected. But if you could dive into the menstrual health side of things.
Yeah, no, absolutely. I love this because very much like the seasons, we have seasons in our body as women, right? Every week of the month is a season. We can start when we menstruate, right? All of the energy we say is kind of in our Daimai and Chongmai area. That's what we call this area in Chinese medicine. So when all the energy is focused here, we don't have the energy to support the rest of our body, hence why we feel more tired. And so during this time, I always encourage women to tune into their bodies to see what they need. I used to be someone who was like regimented on like, let me work out every other day, 4 times a week, let me do this kind of exercise. And, through the past 5 to 7 years of my life, it's really been like, how do I feel at the moment? Do I want to rest? Do I want to go for a walk? Do I just want to lay, read a book? And it's hard in this go society, right? Even when I'm working and seeing 10, 15 patients a day on my period, I'm like, how can I nourish my body to then really listen to it and give it what it needs, right? So I always say, be intuitive, listen to your body. You probably need to rest more than you think when you're menstruating. And then we have the week after, right? And we say that's almost like wintertime. Wintertime is our menstruation. Then we kind of shift into spring. We're kind of, reinvigorating and awakening our energy. Seeds are planted. This is when you can start to do more exercise, to work out more, but also have the energy to be more social. And then you hit your luteal phase, right? Which, it's the beginning of the third week where people are like, oh my gosh, I have so much energy. I can do my HIIT workouts, but I want to be social. I want to, go out and see friends. I want to go to events. That's absolutely when you can do that. And then there's the last week before menstruation happens again. And that's kind of like recycling into, okay, now everything is peaking. Now it's going to go down a little bit. So how can I support myself during then?
I love that you're mentioning all of this because as you shared, it can be so hard because we always feel like we have to be on and on the same schedule for whether it's a workout or work schedule or anything like that. And what I have learned is like, okay, it's actually okay to give myself a little grace in certain weeks of the month to just be like, oh, I'm just going to rest a little more. I'm going to like be a little more isolated and give myself a little bit more self-care.
Yes, exactly. And I mean, this is something I struggle with too, but rest is productive.
Yeah.
It's productive for our body, for our health. And sometimes I have to schedule it in my calendar, be like, that's productive. I'm resting, because I am very much like a go person, but it's all about balance at the end of the day.
Same here. And I also kind of feel like maybe it's a bit of like the Asian upbringing too, of like,
Yep.
Yeah. Like, I know you'll understand that.
Yeah. I mean, speaking of like honest conversations, the other day I was talking to my husband, I'm like, where does this, want and need of drive comes from? Like, is it something that I was kind of born into? Did I grow up with it? Was it like who I was surrounded by? I'm like, why? Like, why do I make myself stress sometimes?
Totally. I know. Yeah. For me, it's like, oh, well, just look at my parents or look at the upbringing and like, the answers are there.
Yeah.
Somewhere.
Asian sentiment for sure.
Yeah. Okay. What is the other card that you pulled?
What's something you're grieving and celebrating at the same time? Oh, I love this. It's so interesting because this reminds me of when I was in Vermont about a month ago. My mother-in-law is incredible. She's a shamanic healer and helps with a lot of energy clearings. And it's very much tied into Chinese medicine because it is a spiritual and energetic medicine. And so we always love to talk about it. And she gave me a session and a clearing, and, a word that came up a lot was grief. And for me, it was less about, grief of a loss, like a loved one, for example, but more so grief of who I am and who I want to be, less about like how people perceive me, but how I want to perceive myself. And I think I've always had this understanding ever since I was a kid to be a doctor of, I want to be a doctor. I want to have a clinic. I want to see patients because that's how I'm going to heal and help the world. And recently that's shifted a little bit more into more of teaching and education and being okay with it. And I think for a little bit, kind of my mind and my heart were not aligned in that way. And that was kind of the grief that I was letting go of expectations of what I thought I wanted as like a practitioner or doctor and kind of what it's transforming into. Because in the end of the day, I love teaching and sharing the medicine. It's like what I'm doing here because I think it resonates with people. It's going to open people's minds to then go to other acupuncturists and seek out Chinese medicine.
It does. How has it felt like with the shift?
It's felt wonderful at moments, but also terrifying at times, where I'm constantly in a state of change and shifting, even like the way that my clinic works, hiring more people to support me. But also, I founded a Chinese medicine skincare line with my sister 6 months ago, and that's taking up more of my time and how I am as a doctor and presenting in the world and educating. So how do I lean into things that come my way and to be okay with the change? I think when opportunities come, when change is happening, I realize that my body feels most comfortable when I just lean into it rather than saying no to things and kind of being wary of it.
Before we wrap, I would love to learn more about your business with your sister.
Yeah. Oh my gosh, I'm so happy to talk about it. It's incredible. I mean, my twin sister and I were, like two peas in a pod, but we're also yin and yang. Okay. We're literally the sun and moon. And the name of the company is called Moonbow, which is a rainbow around a moon. And it happens at like a 10% occurrence. It's very beautiful. And it really talks about the beauty in opposites and polarities, and how we just have to find balance. And balance is where we heal. Balance is where we find happiness. And so we decided to start this skincare line or a beauty line. It's, skincare. So a face wash, a serum, and a moisturizer to start off with, because it's, the basic line that we all need. But it's infused with Chinese medicine herbs. It's herbs that we grew up eating, in food, in soups and teas, but also it's amazing for the skin. And now modern research is finally catching up to say, oh my gosh, chrysanthemum or wild chrysanthemum, which is our hero ingredient, it's extremely beneficial for the face. It's antibacterial, anti-inflammatory, it's high in beta carotene. And it's, all these herbs and extracts that people, I think, are seeking for, but in a more holistic, natural way.
And I think actually now is such an interesting time in society where people are looking for the natural ingredients or looking outside of the box, I feel like, than traditional skincare.
Yeah, absolutely. And sometimes, traditional skincare, when you think about the science route, it's amazing, but it can be harsh, right? These ingredients are broken down to its fine-tuned molecules so it can absorb in your face. But in a sense, like, did our body ever want that? Do we need it at the moment? Or how can we repair its barrier and treat it as if we are nature beings again, right? Like growing up, for example, we used to put chrysanthemum on our eyes for eye size because it's antibacterial, and chrysanthemum goes to the eye channel, right? When you actually consume it as a tea. So drinking the tea and putting on your eyes, the best thing for eye size, but it's also the best thing for inflammation on the skin, for acne, eczema, psoriasis, like anything that appears red and itchy, or rosacea. It's so calming.
And what I love about this is that even though it is skincare, so yes, technically like helping your skin, but it goes into your body too.
Yeah. So everything, all the herbs that go in our skincare, you can also consume it. I mean, not to say, please don't eat the skincare.
Yeah, right. Yeah, there's other ways to eat
licking the
chrysanthemum.
jar.
Yeah.
But, it's encouraging, consumers to really understand that it's a whole, skin health is holistic, beauty is holistic and it comes from within. And the skin is the biggest organ in our body and a manifestation of how our body is in the inside.
Okay, I know that you have a local clinic, so I'd love for you to talk a little bit about that and how your practice is kind of structured. I know it's kind of going through a little shift now, but if you could just share.
Oh, absolutely. I mean, I love it. We're in Culver City. We have 3 treatment rooms, and I kind of built the space to make it feel safe and to feel like you're in nature in Asia. And I have 4 total practitioners, including me. And just because of how Moonbow's going in my life, I've been in clinic less, but not to say, it is my flow state, but I have so many amazing practitioners that support me and support all the patients as well. And I go see them myself. And so that's how we're structured. It's interesting. People are like, oh, what can acupuncture help with? And it truly helps with everything. We have our women's health specialists, we have our pain specialists, our autoimmune specialists, our gut and mind and gut and brain and skin health too, so we offer it all.
And I know you have a cold plunge back there, right?
So we have contrast therapy. So we have a
Contrast
sauna
therapy.
and cold plunge. And it's so interesting because cold plunge in Chinese medicine, when you think about it, it's very much a no, but how can you support your system? It's less about the cold that I like, but more so about the contrast. And there's some rules in Chinese medicine, like if you're in your period, do not go in the cold plunge. If you're naturally a cold person, don't go in a cold plunge.
Okay.
Use the sauna instead. And so whenever we pair it with treatments, we always have education around it.
This is actually bringing up kind of an interesting question for me.
Yeah.
There's so much that is popular in society. Like earlier in the conversation, you mentioned intermittent fasting, but there's also the cold plunge. So there's all these things that are perceived to be like really good for us, but in TCM, perhaps on its own, not. Are there other things that you're seeing in society where you're like, from TCM, no?
We talked about intermittent fasting. We talked about cold. Ooh, what's another one? Electrolyte packets.
Oh, okay.
It's really salty. I mean, salt. I mean, it's when we think about the hypotenacity and like how your cells kind of hold in all the water. Yes, it's hydrating you because it's, making your body more salty. So all of the water is actually flushing to your cells. But then because of that, it's water retention, right? So in a sense, is it the electrolytes you need? Is it the water that you're drinking? But also in Chinese medicine, thirst and hydration isn't just tied to water we drink, but also the food we eat. We talk about our blood nourishment, right? Blood or yin in Chinese medicine, all tied to the fluids in our system. So how can we boost it? So for a lot of women who are thirsty all the time, it means that their blood is deficient. So how can you enrich that? It's almost synergistic to the iron or the B vitamins. Can you eat more red meat? Can you drink more bone broth? Because drinking a bone broth is probably better than an electrolyte packet in the end of the day.
Yeah, I really like that because I do think that there's so many different packets and things that, we're constantly getting marketed, but we might not actually need that. And we might need to go back to the basics of just food.
Exactly. I mean, sometimes, yes, if I'm in a sauna and I'm sweating a lot,
Yes. Yeah.
and if you're a marathon runner, sure, drink an electrolyte packet. But I come from a place where people are drinking it every single day now because like it's part of my routine. I'm like, how's your body responding? Like, are you actually thirsty or more hydrated? Like, what is actually happening to your body?
Yeah. And that goes back to the point of like, be more intuitive with how you're feeling.
Yeah, exactly. I mean, and salt is taxing for the kidneys. You're going to be peeing a lot. Like there's so much to it.
Yeah.
And I guess that kind of leads into this creatine trend too, which
Oh, okay. Yeah. Talk about that, because that's everywhere too.
it's interesting because there's so much modern research now
Yeah.
that they're just like, oh, it's the most research supplement for the body now. But creatine is something that we make as well, right? And it's very much important and synergistic to our kidney health. And so creatine essentially rushes water to the muscles. It helps recovery, but also at the same time, it's taxing parts of your body that shouldn't be taxed. I think there's other ways to recover and other things that you can take, but also supplementation, if it's good for a man who is bodybuilding, it's not going to be great for a woman like me, you know? So why, first of all, like ask the question, why are you taking creatine? And second of all, when you take it, tune into how your body feels. Like for example, my husband wanted to take it because, you know, one of his friends got jacked and he was like, oh, I want to take it. But I'm like, okay, why? And then he was like, I'm peeing so much and I have this urgency to pee and it's kind of painful to pee now. And I'm like, well, there you go. Does it mean that you actually need it? Like, what are your kidneys going through? You know, because that attaches to your bladder. I think it's really tuning into whether you need it or not.
I think that's so wise, because there's just so many supplements out there, and it can feel like, oh, I got to get on this and I got to do this for brain health and this and that. And yeah, it's kind of nonstop. So you do have to stop at some point and question, like, okay, what is it that I actually need? And also, should I just be getting blood work done to see if I am actually deficient in anything?
Yes to both, right?
Yeah.
I mean, I think sometimes I'll see patients who are on like 15, 20 supplements and I'm like, okay, your body's freaking out. You're coming to see me for a reason. So let's just take a step back. Let's kind of, you know, pause on some of them. Let's really understand what your body truly needs. And then they feel better, you know? But back to the point of like, if your blood labs say you are iron deficient or if you need some magnesium, sure, but it shouldn't be every single day for years, you know? It's going to be a temporary boost so that you reach that balance level again.
Well, I think we covered so many different topics.
Yeah.
I know I definitely learned a lot, and I think it will truly open up the eyes and minds of everyone listening, just in terms of what traditional Chinese medicine actually is. It's not necessarily only acupuncture. There's all these other pillars, and it's truly a holistic approach to being well.
Yeah. I mean, it's a lifestyle, which is the fourth
Yeah.
pillar, because, you know, how can we actually incorporate into our life? How can we have it ingrained in our habits? How can we change and shift our body, right? Into knowing that we need to rest as much as we work. You know, it's that balance, because a lot of health issues arise when our nervous system isn't reset.
Yeah. Thank you so much for being here.
Thank you so much for having me.